Walking for BP reduction? Great. But what about yoga or lifting weights or dancing like Hrithik Roshan in Dhoom 2? Do they work too? Namaste, I am Dr. Ameya Amonkar and welcome back to HG Cardiowise. See, most patients who come to me say, Doctor, I already walk. Isn't that enough? We have covered the benefits of walking, techniques like the Japanese interval training, how to start and progress, and much more in our previous video. And while walking is the king, science has shown that strength training, yoga, even hand grip exercises can lower blood pressure significantly. In fact, some forms of exercise are as powerful as medicines when done right. But here's the problem. Many confuse running for the train with exercise, or think lifting grocery bags equals strength training, or believe one yoga session a month is lifelong health insurance. Now it's the time to clear the confusion. Today, we'll explore the entire exercise menu for blood pressure control. From weights to yoga and Zumba, we'll see what actually works, what's safe, and how you can fit it into your life without becoming a gym rat or a professional choreographer. So if you have wondered, Doctor, what's the best exercise for my blood pressure? Stay tuned. By the end, you will know exactly which moves deserve a place in your weekly routine. A quick recap before we dive in. Now, why does exercise matter for blood pressure? Because when you move, your blood vessels relax, stress hormones dip, and sugar and weight get under control. The result, on an average, exercise lowers your blood pressure by 5 to 8 points. That's like adding a free BP pill, but with the positive side effects like better sleep, higher energy, and even a better mood. We already covered this in extreme detail in the walking video, so let's move straight to today's focus. The other exercises, that's other cardio, strength, yoga, dance and more, that also protect your blood pressure and keep you fitter for life. Alright, let's start with cardio. That's anything that gets your heart rate and breathing up. You already know walking is fantastic. We made a whole video on that. But what else works? Let's open the cardio toolbox. The first is cycling. Now, whether it's that weekend ride on your hero cycle or the new fancy spin bike, cycling gives you the same aerobic benefits as walking, sometimes even more because you engage bigger leg muscles. Now, studies show regular cycling can drop systolic blood pressure by 6 to 8 millimeters of mercury. Bonus, less stress on your knees compared to running. Second, swimming. Now, this one's underrated. In a 12-week trial, older adults with hypertension who swam 3 times a week dropped their systolic blood pressure by around 9 millimeters of mercury. And swimming cools you down in the summer unless you are stuck in Mumbai traffic on the way to the pool. Third, dancing or aerobics like Zumba, Bhangra, Garba. Now, who knew your niece's Sangeet could double up as heart therapy? Rhythmic dance keeps your heart rate in the aerobic zone. It burns around 200 to 300 calories an hour and reduces stress hormones. And let's be honest, dancing makes you happy. Happiness itself lowers blood pressure. Now, I had a 38-year-old patient who hated walking, but he loved Bhangra. So I told him, forget the treadmill, let's just dance 20 minutes, thrice a week. And his BP came down by 8 points in 3 months. And so did his weight. Now, his wife told me, Doctor, you saved his heart and revived our marriage. See, sometimes cardiology is also couple therapy. Fourth, skipping or jump rope. Simple, cheap, powerful. Just 10 to 15 minutes equals the calorie burn of a 30-minute brisk walk. But be careful, if you have knee issues, don't go all Rocky Balboa on day one. If you're puffing, sweating and smiling, that's the right cardio. Running after the Virar local or chasing your toddler around the house doesn't count as cardio. That's survival. Aim for 150 minutes per week of aerobic activity as per the WHO and also our Indian hypertension guidelines. Now break it into 30 minutes 5 days a week, or even 10-minute chunks is good enough. Choose what you enjoy. You can cycle, dance, swim, skip, play badminton. See, if you dread it, you won't sustain it. Exercise should be your stress buster, not your stress maker. Okay, let's talk strength training. Now, many of my patients ask, Doctor, won't lifting weights raise my blood pressure? Now, here's the truth. While your BP does rise temporarily during a lift, the long-term effect is the opposite. It lowers your resting blood pressure. Now, think of it like this. When you train your muscles, they become better at using oxygen and glucose. Your arteries become more responsive, like a flexible garden hose instead of a stiff pipe. Studies, including meta-analysis published in the Journal of Hypertension, show that resistance training can reduce systolic blood pressure by around 4 to 5 millimeters of mercury and diastolic by 3 millimeters of mercury. Not as dramatic as your aerobic exercise, but still powerful. And when combined with walking, the effect adds up. I had a patient, 52 years old, diabetic, said, "Doc, gym is for youngsters. I'll stick to walking." We added just 2 sessions a week of light dumbbell and band exercises. 3 months later, not only was his blood pressure lower, but he told me he could now carry 2 full bags of sabzi upstairs without panting. Now, that's the kind of real life win we want. Let me start by giving you some tips. Start light, use dumbbells, resistance bands, or even body weight like push-ups, squats, or wall sits. If your blood pressure is more than 160 by 100, best to achieve some control before starting weight training. Now maintain a frequency of 2 to 3 sessions per week, 20 to 30 minutes each. Just avoid holding your breath, as this can elevate your blood pressure during exercise. Target all major muscle groups, your legs, arms, back, chest and core. For elders, use resistance bands or water bottles. Even sit to stand from a chair counts as resistance training. Of course, don't try to deadlift like Hrithik Roshan in War. Start small, stay consistent. The goal isn't 6-pack abs, it's 6-decade health. Now let's talk about our ancient wisdom. Our Desi superstar in BP control, that's yoga. You've probably seen WhatsApp forwards claiming 30 minutes of Anulom Vilom and your BP is cured. Well, it's not magic, but there is real science here. So how does it work? See, yoga lowers blood pressure by calming your sympathetic nervous system. That's your fight or flight stress engine. Now, stress hormones like adrenaline keep your vessels tight and BP high. Now, yoga flips the switch. It activates the parasympathetic system and relaxes the vasculature. Now, studies in India and abroad show pranayama and breathing like slow deep breathing, Anulom Vilom, Bhramari can reduce systolic blood pressure by 4 to 7 millimeters of mercury. Also, asanas like Shavasana, Setu Bandhasana and Balasana can help relax arteries and lower stress. Meditation adds another 3 to 4 millimeters of mercury drop over weeks. Now, think of it like Wi-Fi for your body. Walking improves the hardware, that's your heart and vessels, while yoga optimizes the software, that's your stress circuits. Both are needed for smooth performance. And the best part, yoga is age friendly. A 25-year-old techie stressed about deadlines, a 60-year-old uncle with blood pressure and a 80-year-old dadi. All can do yoga at their own level. But one special mention, no Shirshasana. In fact, if your BP is high, don't even try it. Stick to safe, gentle postures and breathing. We will discuss about exercise and poses to avoid in our next video. Have you heard of isometric hand grip training? This one is fascinating. It's a simple hand grip device. Just squeeze and hold. Now, studies including the American Heart Association's 2023 guideline show isometric hand grip can reduce systolic blood pressure by up to 5 to 10 millimeters of mercury over 8 weeks. Think of it like BP physiotherapy for your vessels. Only small squeezes, they make your arteries learn to relax better over time, like rehearsing calmness. Protocol is to have 4 sets of 2 minutes sustained contractions at about 30 minutes of your maximum voluntary grip strength. Now, resting for 1 to 2 minutes between the contractions is recommended, and do this 3 times per week. It improves vascular function and autonomic balance. It's cheap, safe, and can be done at any age. And you can do it even while watching television or waiting for your chai to boil. It's so effective that the Canadian guidelines list it as a recommended therapy. Some caveats though, not for people with uncontrolled hypertension, that's more than 180 by 110 millimeters of mercury. It may be unsafe. It should not be the only exercise, works best as an adjunct to walking or cardio, and avoid holding breath while squeezing. So always breathe normally. Now let's be real. Not everyone can or should be running 5 kilometers. For older adults or those with knee pain, arthritis or other health issues, safety first. But that doesn't mean you can't exercise to lower your blood pressure. Now here are practical BP friendly options. First is chair yoga. So gentle stretches and breathing while seated. Perfect for those with mobility issues. Second, resistance bands. Lightweight, portable and joint friendly. Maintain strength without stressing the knees. Third, short frequent walks. So instead of trying one long brisk walk, try 10 to 15 minutes after each meal. Science shows that post-meal walks help control both BP and sugar. And finally, everyday activities like your sweeping, gardening and dancing lightly at your grandchild's birthday, they all count if they raise your heart rate a little. Now, safety tips. First, monitor your BP regularly. Don't push through dizziness, chest discomfort or unusual fatigue. Second, avoid overexertion. A light sweat, light breath is okay. If you're gasping or dizzy, scale back. Third, stay hydrated. Dehydration itself can raise blood pressure in the elderly. And here's where technology helps. Fitness trackers, smart watches, or even a simple pulse oximeter can guide you. Aim for 50 to 70% of maximum heart rate. That's science. But here's the easy translation. Walk at a pace where you can comfortably talk to your friend, but not sing a full Kishore Kumar song. So if you're still belting out Mere Sapno Ki Rani mid-walk, you're probably going too easy. So here's the bottom line. You don't need a fancy gym membership, protein shakes, or an Instagram trainer. The best BP workout is the one you can actually do consistently. Mix and match, cardio for your arteries, strength training to keep muscles and metabolism strong, yoga and pranayama to keep the stress that sneaks blood pressure up, and yes, even that quirky hand grip exercise that has science behind it. And for seniors, gentle, safe, simple moves like chair yoga or short, frequent walks can work wonders. Think of it like a thali. Cardio is your dal rice, strength is the sabzi, yoga is the salad, and hand grip is the pickle. Put it together and you have a perfect balanced recipe for a calmer, healthier blood pressure. So now you know exercise is not just safe, it's powerful for BP control. But not all exercises are safe if you have hypertension. Heavy lifting, breath holding, certain intense sports, these can be risky. And that's why in our next video, I'll reveal exercises hypertensives must avoid. So don't miss it. Hit subscribe, tap the bell, and share this with your gym buddy or yoga group, because now you've got the real science, not gym gossip. See you in the next one.